I'm still
Hi,
here.
Johnny.
Yes.
Hi, Assemblywoman. This is such a pleasure to see you.
Yeah.
Like you said, unfortunately under these conditions, but it's a real pleasure to have you because there is so much. We really don't have a whole lot of time, but there is so much information that we think that's going to be so important for our community to hear about from you. I guess the first thing to start out with is how are you? That's the very most important question to ask anybody now before you ask anything. How are you?
Well, I'm feeling a lot better. I know a number of people saw me on Facebook. I was tired. I was coming back from Albany, and we spent a week there. Many of us did not want to go, but we are considered as essential workers, and we had to go to Albany because
Assemblywoman. It's such a pleasure to see
the New York State budget was passed. If the New York State budget is not passed, that means that no one is paid. Our healthcare system would be at a status where they can't function and help save lives. We wanted to make sure that we voted on dollars that would provide resources for the hospitals, especially the distressed hospitals. We wanted to make sure that Medicaid was intact. There was a 2.5 billion cut in Medicaid, and the federal stimulus pack is going to supplement the cut. So everything was restored,
Okay.
including our ambulance. We're very happy about that. We wanted to make sure that the education budget for all of our education, for our schools, our public schools, were intact. So it was flat, as well as our colleges. We had voted against increasing tuition. So we're very happy about that. We also made some changes on some things like surrogacy. I don't know if many of you know, but New York State was one of the only 3 states that made surrogacy, gestational surrogacy, illegal. And this week we passed it to make it legal, which means that another person could be carrying a baby. There are many men who wants to have a baby. There are LGBTQ couples who want to have baby. There are women, single women, or married couples who want to have babies, and for some reason they just can't. And this would be an option for them to do it legally in the right way where it's not exploited. We also banned flavored tobacco. I'm sorry, not flavored tobacco, flavored e-cigarettes.
Okay.
So, as many of you know, a lot of our youngsters have been smoking or vaping, and a lot of products have nicotine. So they get lung illness at a very young age, and their lifespan have shortened. And so we have banned flavored. What the tobacco companies were doing, they were using these flavors like strawberry, bubblegum, things like that to lure the kids.
Right.
A lot of kids vaping, and they think, oh, it's not cigarettes, it's safe. But to find out that there were some kids who died, they had illness, so we passed that. We also did something that I was not proud of, which was bail reform. We rolled back some levels of bail reform. Last year, we took away cash bail, and we made misdemeanor cases were not violent and non-violent felonies a way for people not to stay in jail, just to stay in jail. We also pushed to speed the process so a person is not staying in jail while they're getting all the information together. Well, there were a lot of people who were against the bail reform who pushed back. And so we included some of the things back. We made the discovery a little bit longer. We added some misdemeanors back into bail eligibility. So, we weren't too happy about that, and we called that bail rollback. But all in all, we were in a position to pass the budget. State employees can get paid. The hospitals can get their monies. Healthcare workers can get their monies. And so finally, I'm back here. And every day, my staff have been sending out updates on COVID in terms of where we are in terms of the counts. And right now, as of today, the count for New York State confirmed is 122,031 people is confirmed that they have the coronavirus.
Wow. Okay.
New York City is at 67,000, 551
So
for
more than half then is in New York City.
more than half. Yeah, about 60 to
60%.
70%. Yes, it's in
Wow.
New York City.
Okay.
We have a total of 4,159 deaths that was confirmed in New York City. And also in Brooklyn alone, Brooklyn has 16,488 confirmed cases.
Wow.
So the numbers are skyrocketing. Unemployment rate is at its highest. Over 3.2 million cases were filed 2 weeks ago. I don't know what the current number is. So it's really a tragic. I mean, I think we're all in this together. We are constantly updating the community on what's going on. 1,000 military personnel was deployed to New York this week. And Governor Cuomo, as you heard, he donated 1,000 ventilators from the Joseph Clara Tsai Foundation and the Chinese government. We got 140 ventilators from Oregon, from Governor Kate Brown, which is great that other states are working with us. We also received 1 million surgical masks from the NBA with collaboration of the Knicks and the Nets, the Brooklyn Nets. Also, I don't know if you know, but Javits Center was deployed. It's a new space. It's a new hospital-like environment. Before, they weren't accepting COVID patient. Now they're accepting COVID patient. So we're very grateful about that. There was an executive order announcing that medical students slated graduated to begin practicing to assist COVID. I know people like my friend's daughter. She's a resident. She's a podiatrist resident, but all the residents were drafted to work on COVID cases. Just so you know, it's really, yeah. You have many people, podiatrists, dentists. People who are in every aspect of the medical field have been drafted to help with the COVID cases. Right now, I don't know if you heard, but Mayor de Blasio had announced a deal with JetBlue and United Airlines to fly healthcare's workers who are assisting with coronavirus into New York for free. I know there are many people from all over, and I know Mona Lisa, we even have our friend Marie Hippolyte, who said, hey, she wants to help. So there's a deal where people can come for free to help and be on duty. And I think I mentioned about the 1,000 military from President Trump. Right now, Javits Center also have about 2,500 beds, makeshifts. So that's a lot. Yeah. We want to be able to sufficiently address the issue and then also be able to help people who are in need. A lot of the people go to the hospital and they're turned away, and the doctors would say, hey, you're not in critical condition. We will give you Tylenol. In many of those cases, people dying home. You know, it's too late. They don't know their symptoms. They don't know that having short of breath or their lungs are filled with fluid is too late. So they go home and they die. Yeah. So it's really important. I know we've heard doctors on the call and so forth, but it's really important, especially in Creole, that people monitor their symptoms and do the strategic thing, you know, whether, you know, checking your temperature every 2 hours, is it escalating, taking Tylenol to reduce it. If you start feeling that you have a shortness of breath, you should really rush to the hospital, because at some point you won't be able to live. When you go to the hospital, they can give you oxygen. Right. Oxygen can help you with your breathing levels, things of that nature. But you really got to be strategic. I know a lot of people want to go to the hospital if they have a fever, but many people have fevers, and they just weigh it out. They take their pills and they weigh it out, and then they.
Yeah, we saw the brothers, the governor's brother, who
Mhm.
also Chris Cuomo, who also has the virus, and basically everything that you just mentioned. In fact, I was watching him the other day talking about how he has an ability to check not only whether he has a fever or not, but to check his oxygen level. Obviously, he has a bit more sophisticated
Of course.
system set up in his house, but also how difficult it is physically on him. But Assembly member, one of the things that obviously that's going to be extremely important, and I guess the question that I wanted to follow up on, there's a few things, right? The first is as we talk about how this particular virus has uh, uh, affected our communities. I think we see a convergence, right, between, because I saw a map today that showed sort of the places that are most affected are places that have larger immigrant communities. And what this demonstrated is, number one, the fact that a lot of these immigrant communities are working in these fields or these areas that now are considered, before we never considered them to be important, right? But they are important now. So these people are on the front line for us, whether they are working at the supermarket or they are doctors, or like you had to go back to Albany to do your work. You guys are essential workers. So you sort of see the concentration of that, right? So there's an aspect of economic as well as sort of immigrant communities being affected by this. When you think about this bill that recently passed and how this money then is going to flow through from the states to the cities, have you any sense of how communities could, particularly our community, Haitian community, are going to need to start, or at least our community-based organizations need to start thinking about how to access resources that will be available for our communities?
Yeah. So one of the things is, for one, to your point about our communities being affected, immigrants, because we work in the healthcare field. One of the other reasons, because we have a more concentrated area. So, we have a lot of people living in our homes, right? And so if we have like 4 or 5 people living in our homes, obviously one person get contracted with the virus, everybody gets contracted with the virus. So we in central Brooklyn, which is in my area is one of the highest infected area. We have buildings, we have renters, we have people living on top of each other. Okay, and like, as you mentioned, immigrants, our values, we don't put people out. We just have a lot of people living on top of each other. What we're trying to do in terms of the resources, we're trying to be on, radio stations. We're trying to be on media outlets where the Haitian community in particular, let's say, would listen and get access to some of the information. I send out an email. I try to get on as many media outlets as possible. And people would call me, and I would refer them to my office, who would help them with resources like business. We had a lot of the small businesses who are losing money, like the hair salons, the barbers. And there's available resources where small business services not only would give them a loan, but would actually pay 40% of their payroll, just as long as they keep their employees.
So let me just, I just on this point, it's so important. I think I just wanted to kind of maybe take a second on it. So if I'm hearing you correctly, that there are resources that will be available for small businesses who will have to have access to loans that would allow them to continue to pay their employees. Is that correct?
Exactly. It's called the New York City Employment Retention Grant Program. It's a grant that offers small businesses and nonprofits that have fewer than 5 employees a grant of that will cover the payrolls of 40%. Okay. And that's up to $27,000 for 2 months to help retain the employees.
Okay.
That's yeah.
That's an
And
important thing because we know that in our communities, there are a lot of the barbershops, there are a lot of the restaurants. And for these, not only for the businesses, it's already hard. And there's a lot of different programs, obviously, but this is specifically for New York State.
mhm,
Um, but on the businesses themselves will probably have, packages that they can access, but this is very specific to their ability to continue to pay their employees, which
exactly.
is extremely important because those are folks who it's paycheck to paychecks, right?
Mhm,
And
mhm,
they
mhm.
need the loss of 2 or 3 paychecks could mean a significant loss for those folks in our communities.
Exactly. Exactly. And a lot of times, our community, because we have a language barrier, they may not know who or how or who to call. Luckily, I speak Creole, Pale Creole.
Hmm.
So they call me, and luckily, ironically, I didn't plan this, but I have two people in my office who speak Creole too. So they can speak to them in Creole and tell them what to do. We also have programs, and there's an executive order in terms of rents and home ownership. So there's a lot of people who obviously, because they're not working, they cannot pay their rent.
Hmm.
So there was a rent freeze. Mayor de Blasio called the rent freeze on all rents in the city of New York. And Governor Cuomo had announced a 90-day mortgage relief. So people who are paying their mortgage, and many of them who have people who rent part of their house or whatever, they know that they can't pay the mortgage. So there's a 90-day mortgage relief for those who are having difficulties. And that also extends to waiving overdrafts and credit cards. Okay,
Okay.
credit cards, overdraft, and no negative reporting.
Okay. So
So,
just
mhm,
on this point, if I pause, because we don't want people to assume that maybe they can just call the banks now and say that there's a pause, so they're not going to pay for 90 days. This
mhm,
is number one. If you are a renter, people need to understand that you can't get kicked out. That's the number one thing, right?
that's the
You
number one
can't
thing.
get evicted if
Mhm,
you're a renter. But obviously, if the renters cannot pay their rent, that means the owners
mhm.
cannot pay their mortgages. And so if you find yourself in a situation where you cannot pay your mortgage, then you should reach out to your bank because there's a 90-day period in which the bank can allow you to not pay that mortgage for 90 days without any penalty. Is that correct?
It's supposed to. So
Okay.
now the tricky thing is, I would tell everybody to, s'il vous plaît, call their banks.
Hmm.
Their banks, or see what kind of programs online, register, because after the 90 days, and this happened during the Obama years when he took over, and a lot of people were losing their homes. They were applying for loan home modification, and what happened is, after that window of not paying, the banks turned around and said, well, you owe us this lump sum of money, and we're going to take your home from you. We want to make sure that doesn't happen after the 90-day moratorium is lifted. We want to make sure that these homeowners are secured, and we also want to make sure that the renters are secured as well. We had a bill that I'm on where would cancel the rent of the three months moratorium, which would mean that the renters wouldn't pay, and the mortgage owners also would be able to write off those 3 months, and again, not be negatively affected. So the effect would be on the banks. We also say there illegal lockouts. If your landlord has locked you out of your apartment, you can file a case for an emergency courtroom. Okay, and only a judge can evict you, but the judge will not evict you, obviously. Also, marshals, the Department of Investigation notified that all city marshals that all eviction proceedings are suspended. So marshals cannot come and kick you out. Emergency repairs. The emergency repairs include access to heat and hot water. Okay, lead cases and serious housing code violations, including lead remediation. And there's a number to call if you need any emergency repairs from New York City. There's a whole bunch of information on rental assistance, rent freeze, as well as discrimination and harassment. No one could not harass you. Those people who are experiencing income loss, there's a NYCHA self-service portal. There's an opportunity to work in NYCHA. Also, there's Section 8 participant can report a decrease in their household income by completing an interim verification. So there's ways that are being mitigated so that resources, Section 8 vouchers can readily be available for these people. Same thing for the homeowners. There's information on lien sales. If you don't pay your property tax, typically they would try to come after you to take your home on a lien sale. You'll be protected by that. Mortgage payments, Fannie Mae and Freddie Mae had issued detailed information regarding the mortgage relief. So there's information on that. There's a whole bunch of information, and I know it's very hard for our people, our Haitian Creole speaking people to know what is available for them, but there's legal assistance. With the typical organizations that typically help are available to still help virtually. They're available to make calls like Flatbush Development Corporations and Neighborhood Housing Services and Impact. So there's a lot going on. We're just hoping that we can utilize media outlets to access our people since they're home. I know they listen to Haitian radio stations. They listen, they have the box or whatever, or they do internet radio. We're just hoping that people can continue to listen on all information that's available for them.
Wow. Well, Assembly Member, you've shared quite a bit of information with us today. And we truly appreciated all the hard work that you're doing. And I know that it must not have been easy for all of you to kind of sort of all have to travel to go to Albany and be, out there to debate this bill and then to vote on it. So truly, as a New Yorker, I just want to thank you for the work that you're doing. We're not going to keep you any longer. What we're going to do is, Mona Lisa and I was going to do a little bit of summary of everything that we heard from you and try to distill it, obviously not as well and in detail as you have, but I think what we'll do is capture maybe a couple of points that will be that are most important. I think the ones that we'll focus on is the fact that, first of all, that you and others in New York State Assembly have voted on the budget is the very first thing, so that people know, for those who have family members who are either, school teachers or working as nurses or doctor, whatever it is, whoever's working for the state or the city, that the budget has been voted on and that they will get paid, right? Because that's one less stress that people don't need amongst all the other stresses that they've probably experiencing right now. Mm-hmm. The second thing is in that package that you have voted is that it protects, people all across the board, people, whether they are renters or whether they are owners. But also what it does is that it created, it put in the resources that are necessary to ensure that people receive the medical services that they need. And you shared with us quite a bit of information about sort of the different partners from the federal government who sent, made 1,000 soldiers to help manage things, to, private sectors, the NICS, the NETs, who kind of donated masks and all that kind of stuff, to even the Chinese government who sent some donations. And so these things are really important for people to know, that there are people working on their behalf. And sometimes when we are locked in our homes, we don't know what's happening. And the first and most important thing is information, right? It's knowing that, the Assembly did its part and that, there are people who are making sure, the health workers have what they need in order to respond if someone falls ill. The other point that I got from what you said is that, yes, if you feel that you have a fever or if you feel you have migraine, make sure that you're tracking that. But if you feel that you are in a position where, you have shortness of breath and you have all of the signs of COVID, make sure that you go to the hospital to get tested. Don't rush just because you have a headache. Don't rush just because you feel like you have a fever, because this might be, you could have a fever, but there are multiple signs that people need to kind of make sure they have before they rush to the hospital to not overwhelm the hospital. And, I think it's really important for us to be able to share all of that information. And I don't know whether on your website or somewhere in your office, if there are available information that we can go and pick up from your website and make available to the viewers and the listeners of this show, but most importantly to other friends and colleagues and nonprofit organizations that, Mona Lisa and I and others are engaged with on a regular basis. So is there, as a last word, is there anything that you want to close with? And is there any, will there be any information that will be on your website that we'll be able to get directly from you?
Yes, so we have some information on the website. If you Google Radnitsky Short Assembly, I have one website. We are asking people that they can call my office for any issues, 718-940-0428. It's redirected to individuals remotely. Okay. And they can help you with if it's a rent issue or home ownership issue or business issue or an update. They can certainly help you with that. I just wanted to also quickly say that for school, the kids will be continuing remote learning through the spring break, 4/7 through 4/17, and the religious holidays won't be a day off. So just so you know that, I know a lot of people thought they would have a day off on the 9th and the 10th, but they won't. They won't. And I know people are asking for their federal taxes and things of that nature. That will be done via direct deposit. So they will get that directly through their bank. Also, the lower income families will be the prioritized families who will get their checks from the stimulus. But right now, again, I'm available, so people can call, again, 718-940-0428. If you want to personally email me, my email is rbichotte@gmail. I can put you on my list where we send out information every single day on the current status of COVID.
Great.
It's been a pleasure being on the show. I want to thank you, Johnny and Mona Lisa, for inviting me. I look forward to being available to do more shows since, we're home. And this is essential. I have to do this because I need to tell the community updates.
Wonderful. Well, thank you so much.
Assembly member, before you leave, I'd like to take the opportunity to thank yourself and your office for a job well done with the community, because a lot of my Haitian families, from the schools and from all over Flatbush, of course, they'll reach out to me for anything. If they call the office, they don't hear anything, they definitely jump on the call and call me. Mona Lisa, I need this. I'm not getting it done. But I gotta compliment your staff, Pierre Gideon, who's also Haitian, and he's definitely, available. Although he's working from home this past week, but he was able to answer to a lot of my calls, a lot of my, of your constituents, of course. But they'll go and call, somebody that they can relate to, somebody who can understand them quickly. But Pierre Gideon is definitely has been very efficient. A lot of the business folks in the area have been very grateful that he sat with a lot of the barbers. They're very grateful for that. A lot of the store owners in the area are very grateful that your office has been of assistance and has helped them with the application process, for grants. and a lot of them are anxiously waiting. And I told them, listen, just be patient, sit back, relax, don't worry, everything's going to get taken care of. But again, we're glad to have people like yourself in office and somebody that our community, our constituents can definitely count on. And they don't have to be Haitians, whether they're Jamaican, Trinidadian, Black American, they can feel welcome, at your office on Flatbush Avenue. And trust me, they never fail to express their gratitude because they know once they tell me, the message is going to get to you regardless. But again, like I said, we're very grateful that you had to take time out of your busy schedule. And I know how tired you are, but you created time for us this afternoon to share your the latest with the community. Thank you for everything that you do day in and day out, having to go to Albany and, represent all of us. Please keep up the good work and understand that we all support your leadership. And we look forward in the future days, as we go through this together, that we come, across victorious. And pray for me so I can continue to hang in there. For the record, I wanted to, everyone that's listening to this live, I have not yet been diagnosed. I am fully healthy so far. It's just having to take in so much with this COVID. But again, a woman like yourself in leadership means hope for all of us, who are going through this. And your strength help all of us to carry on, Assemblymember Bichot. Again, thank you again. Keep up the good work, and we'll be around to watch your progress in leadership.
And Mona Lisa, we should probably say we wanted to have the Assembly member on to congratulate her, right? During Women's History, her story month, remember?
I know, I told her that.
It was her
Johnny,
story month.
I said this afternoon, I'm going to keep my mouth shut and let you lead the show. I'm going to let you have your time with her.
Right. Well,
I hope she knows. I told her.
We are so extremely proud of this milestone that you have achieved as the head of the Brooklyn Democratic Party. And I think, a lot of folks in our community don't understand what you've achieved. And I think that's for another time. But we really just wanted to say congratulations on really this major achievement, this major milestone. And I wish you, but Mona Lisa and I and the community wish you luck. And if very often you're serving us, but if we can be of service to you in anything, because we need you to be successful in this. And so whatever we can do as a community to support you in this work that you're doing, you can count on us.
Oh, thank you. I really appreciate that. And what you guys are doing now, being a mouthpiece to the community, that's like what's probably most needed, especially during this time. And, I just want to say, I could not have elevated without people like you. Mona has been certainly a big part of my political endeavor, and her dedication, her loyalty, and her belief in me and her hands-on work definitely was a contributing factor to my elevation. And so, we are all in this together. When I rise, you rise. When I'm rising, I make sure I rise with everybody. And, we have 5 electeds in the Assembly, and hopefully in the City Council we'll have more electeds. We have 2 Haitians. We're going to have more. So we're all in this together. And I just want to thank everyone for supporting and believing in me. And I look forward to coming back in the show to talk about that.
Absolutely.
Yeah.
Well,
Yes,
take care.
We'll be more than happy to have that.
And have some rest. Get some rest.
All right. Thank you. I'm going now to another meeting.
All right.
Another Zoom meeting. All right. Thank you so much. And God bless.
Thank you, Assembly member.
Thank you. Bye-bye.
It was a pleasure. We love you.
Love you too.
Donc, Mona Lisa, c'était vraiment une grosse opportunité, un gros plaisir. Nous avons un pile bagaille et de Assemblée maintenant. Et je pense que, je pense que prochaine show, peut-être nous capables juste semaine prochaine prendre information ça et puis essayer et non seulement traduire mais et porter yon l'autre façon pour que tout le monde dans la communauté est vraiment capable de comprendre qui quantité de travail qui fait et qui gens et travail ça pour affecter vie dans semaine et mois qui venir.
Johnny, gon bagay pile moun pa comprendre nan position nou nan communauté a. C'est que nous avons un groupe haïtien dans la zone Brooklyn nan qui pas accès à information, mais là yo habitué avec un monde qui dans radio, comme par exemple, yo connaît moins on a personal level, soit yo te rencontré dans meeting. C'est comme si m'ta moun nan tout li tout latch on, il pas plagué. Mon petit groupe dans WhatsApp venir partager avec yo n'importe question yo gen sur immigration, c'est moi même qui avocat. Yo gen question sur affaire l'école, puis petit yo c'est pour yo contacter moi et moi même pas contre toute bagaille, quel que soit ça me pas connaît nous gen l'autre monde dans ce call là nous dit qui partager ressources yo tout et bien nous toujours inviter yo pour aider citoyens haïtiens qui vivent dans la communauté. Mais c'est comme ça nous travaillons yo ensemble avec l'autre, c'est une équipe nous travaillons ensemble. Mais nous comptons de ce que, quel que soit Jean Bagayoye, nous mettons tête nous au service de communauté haïtienne dans la New York. Eh bien, nous avons demandé qu'on mette la force pour nous continuer dans ce chemin parce que nous réaliser, nous pas là seul, nous pas vivre dans un petit cercle pour contre nous, mais il y a un travail pour nous faire, nous pas qu'à démissionner comme ça. Nous obligés de camper, crier en avant, kembe bannière bateau, kembe en main pour nous capable arriver ensemble dans destination nous toutes nous aller. Et bien c'est comme ça. N'a pas campé pour après-midi puisque là nous censé arriver, n'a cassé rendez-vous pour dimanche prochain avec émission habituelle nous émission pile monde remet le Mojo Show. And Johnny, thank you so much for being such a great partner.
Thank you.
Merci de ce que c'est un ami, un frère.
Thank you.
Un collaborateur.
I love you, sister.
Yon que nous ka compter sur lui.
Absolument.
En dépit de tout. Qui bagaille yo boy pas bon mais nous la donne ensemble.
Ensemble.
Et nous yon là pour nous kembe l'autre pour faire le chemin ensemble.
Absolument. OK, eh bien, Kembe là, nous souhaitons tout le monde un bon après-midi et puis bon, nous pas de chance de parler avec docteur, mais comme je pense qu'il y a une autre opportunité pour nous baler, pour nous faire une discussion avec lui. Nous souhaitons lui un bon après-midi tout. Et nous avons dit tout le monde.
Nous avons invité pour une émission spéciale sur Covid là, parce que Covid là, il va pas aller. Là, pour un bon petit temps. Quoi, malgré nous avons aimé Covid à faire ou mais il est là pour quelque chose. Nous ne pouvons pas être nous mentir, Johnny. Et nous anticiper, inviter Dr. Hazel pour le capable de venir, parce que c'est spécialité de tout. C'est spécialité de Dr. Hazel et il a trop content pour le venir, pour le partager sur la connaissance avec la communauté haïtienne.
Très bien. Eh bien, sous ça, nous dit bonne soirée et à la prochaine.
C'est un plaisir.
it good?